Hello, this next module is related to mobility and immobility. The ability to move contributes to a patient's self-worth and well-being. A decline in the patient's mobility can result in health problems, and factors contributing to the patient's immobility include length of stay, severity of illness, emotional status, and physical condition. Students need to be aware of physiological, psychological, and developmental outcomes of immobility. Movement requires a coordinated effort between body systems. Nurses pay attention to body mechanics to avoid injury to self and patients. Body mechanics are the coordinated efforts of the musculoskeletal and nervous system as the person moves, lifts, bends, stands, sits, lies down, and completes daily activities. The greater the surface area of the object that is moved, the greater the friction. So large objects produce greater resistance to movement, and that is why nurses need to be aware of the friction that can cause a patient's skin to shear or tear when positioning them, especially when in bed. So the skeletal system provides attachments for muscles and ligaments and protects vital organs. It also provides leverage for movement. Bones also store calcium and release it into the circulation as needed. Patients with decreased calcium regulation and metabolism are at risk for developing osteoporosis and pathological fractures. In addition, the internal structure of long bones contains bone marrow, participates in red blood cell production, and acts as a reservoir for blood. Coordination and regulation of muscle groups depends on muscle tone, activity of antagonistic, synergistic, and anti-gravity muscles, and neural inputs to muscles. Looking at the skeletal system, joints connect bones. Synostotic joints refer to bones joined by bones. No movement is associated with this type of joint, and the bony tissue that forms between the bones provides strength and stability. For example, the skull, where fusion of the joints occurs later in life. In the cartilaginous joint, cartilage unites bony components. This type of joint allows for bone growth while providing stability. When bone growth is complete, the joints ossify. Fibrous joint is a joint in which a ligament or membrane unites two bony surfaces. The fibers of ligaments are flexible and stretch, permitting a limited amount of movement. For example, the paired bones of the lower leg with the tibia and fibula. The synovial joint is a freely movable joint in which surfaces are covered by articulate cartilage and are connected by ligaments lined with synovial membrane. An example is the joining of the humeral and radius and ulna, which is a pivotal joint. Ligaments are white, shiny, flexible bands of fibrous tissue. They bind joints together and connect bones and cartilage. Some ligaments have a protective function. For example, ligaments between the vertebral bodies prevent damage to the spinal cord during movement of the back. Tendons are white, glistening, fibrous bands of tissue, and they connect muscles to bone. They are strong, flexible, and inelastic, and they occur in various lengths and thicknesses. Cartilage is a supportive tissue, and it can be temporary or permanent. The fetus has a large amount of temporary cartilage, which is replaced by bone developed during infancy. Permanent cartilage is unossified, except in advanced age and diseases such as in osteoarthritis. A person's flexibility is demonstrated through range of motion. However, strength and flexibility do not result entirely from these four structures. Adequate skeletal muscle is also necessary. Muscle movement and posture of the skeletal muscle systems are important for leverage and posture. So for example, muscles of the lower extremities, trunk, neck, and back are concerned primarily with posture, the position of the body in relation to the surrounding space. Muscle tone is the normal state of balanced muscle tension. When a patient is immobile or is on prolonged bed rest, activity level, activity tolerance, and muscle tone decrease. The nervous system regulates movement and posture. Movement is regulated in the voluntary motor area of the cerebral cortex. Neurotransmitters transfer electrical impulses from the nerve across the neuromuscular junction to the muscle. Posture abnormalities can be congenital or acquired. Some deformities may affect or limit range of motion. Injury and disease lead to many alterations in function. Any disease that affects muscles or musculoskeletal function will impair muscle development. And damage to the central nervous system will affect body alignment, balance, and mobility. Damage can result from head trauma, stroke, meningitis, or injury to the cerebral cortex. Direct trauma to the musculoskeletal area can cause bruises, contusions, sprains, or fractures. These can all cause muscle atrophy. Patients with impaired body alignment require nursing care to maintain correct positioning, such as supported Fowler's position, supine, prone, side laying, and Sims positions. Nursing knowledge base related to safe patient handling is very important. Manually lifting and transferring patients contributes to the high incidence of work-related musculoskeletal problems and back injuries in nurses and other healthcare staff. Patient movement algorithms serve as an assessment tool and guide safe patient handling and movement. Today, many states have laws that mandate safe patient handling in healthcare agencies using the elements listed above. Appropriate friction-reducing assistive devices and mechanical lifts need to be used for patient transfers when applicable. No-lift policies benefit all members of the healthcare system, patients, nurses, and administrators. When using lift devices, ensure that you have two people, that you follow operation procedures to keep yourself and the patient safe. And also, use findings from evidence-based nursing research about safe patient handling to prevent injuries to nurses and patients when moving and transferring. So factors influencing mobility and immobility. Patients may experience mobility and immobility in degrees. Mobility can be thought of as a continuum, as patients can move in and out of mobile states. Musculoskeletal deconditioning and lack of activity can result in a series of symptoms often referred to as hazards of immobility. Immobility has systemic effects. It's important to stress that the longer the patient is immobile, the greater and more pronounced the consequences of immobility will be. Prolonged bed rest increases the heart workload, producing an increase in oxygen demand. Immobility can lead to joint contractures, which is characterized by abnormal fixation of a joint. Immobility presents hazards in the physiological and psychological and also developmental dimensions. The risks of disabilities related to immobilization depends on the extent and duration of immobilization and the patient's overall level of health. When the patient is immobile, the body often excretes more nitrogen than it ingests, which causes a negative nitrogen balance, leading to weight loss, decreased muscle mass, and weakness resulting from tissue breakdown, also called catabolism. The psychosocial effects of immobility can be emotional and behavioral responses. Immobilization changes the patient's daily routine, and the patient has more time to worry about disability. Withdrawn patients often do not want to participate in their own care. Across the lifespan, each age group will experience problems when immobility is experienced. Developmental stages influence body alignment and mobility. The greatest impact of physiological changes on the musculoskeletal system is observed in children and older adults. The immobility assessment consists of the following categories. Metabolic assessment includes measurements and analysis of intake and output to assess for dehydration. The respiratory assessment includes inspecting the chest wall for movement and auscultating the lungs for decreased breath sounds, crackles, and wheezes. The cardiovascular assessment includes measurement of vital signs, peripheral pulses, apical pulse, orthostatic hypotension, deep vein thrombosis, and edema. A dislodged venous thrombus, called an embolus, can travel through the circulatory system to the lungs and impair circulation and oxygenation, resulting in tachycardia and shortness of breath. The musculoskeletal assessment includes assessing muscle strength and tone, loss of muscle mass, incidence of contractures, and range of motion. The skin needs to be assessed for integrity or early changes in skin condition. When assessing the elimination system, intake and output, bowel sounds, and bowel and bladder habits need to be checked. During the psychosocial assessment, you will focus on the patient's emotional state, behavior, and sleep-wake cycle. The developmental assessment looks at how immobility affects the normal development of patients across the lifespan. When planning patient care, the planning phase establishes patients' goals and outcomes. The nurse needs to develop goals and expected outcomes to assist the patient in achieving his or her highest level of mobility and reducing the hazards of immobility. It's important to set priorities when planning care to ensure that immediate needs are met first. This is particularly important when patients have multiple diagnoses. Plan therapies according to severity of risk to the patient. Individualize the plan according to the patient's developmental stage, level of health, and lifestyle. Do not overlook potential complications. Care of the patient experiencing alterations in mobility require a team approach. Nurses often delegate some interventions to nursing assistive personnel, so it's important to collaborate with other healthcare team members and physical and occupational therapists to consider mobility needs. In anticipation of patients discharged from an institution, make referrals or consult a case manager or discharge planner to ensure that the patient's needs are met at home. Health promotion activities include a variety of interventions such as education, prevention, and early detection. The rate of work-related injuries in healthcare settings is on the rise. Most of these injuries occur as a result of overexertion, which results in back injuries and other musculoskeletal problems. Back injuries are often the direct result of improper lifting and bending. Get help, if necessary, before starting a lifting task, and follow correct lifting procedures. Exercise has many positive health benefits. Assist patients in overcoming barriers to physical activity and encourage them to perform activities that are within their ability. Take cultural practices into consideration. For patients diagnosed with osteoporosis, early evaluation, consultation, and a team approach are important interventions, especially when they become immobilized. Activities of daily living help a patient maintain independence. In this picture, you can see a person who is lifting an object. So which picture shows an incorrect way to pick up an object? And which picture demonstrates the proper way to pick up an object following good body mechanics? So this concludes part 1 of mobility and immobility.